The Partners in Recovery program is a new service to provide a wraparound service for clients with severe and persistent mental health issues. It's a program that is there to facilitate services that are involved with the client, to link them into services if they require that, and to work closely with those services to communicate better, as well as family members if they're involved in that person.
I think the current system's fragmented in terms of communication and just pathways between services.
As a support facilitator, we're not actually doing everything ourselves. We create a shared responsibility of the care team, and we make sure that everybody is following up and accountable for their role in the client's care.
The role of a support facilitator is not to take the role of a case manager. It's to include a case manager in a plan that might include other services and other roles, support workers, GPs, family members. So it's to enhance the role of a case manager in some ways.
So when you would refer to Partners in Recovery, it can be referred from a consumer, a carer, or a service provider, a professional. And then that comes through the central intake and would be allocated to a support facilitator.
When we're meeting a client for the first time, we're quite flexible as to where we can meet them. We can go out to their home or even to an outside place where they would feel comfortable. Often the Indigenous clients that are referred to Partners in Recovery have touched base at the Victorian Aboriginal Health Service at some point or another, and it provides a safe place for them.
When a person comes into Partners in Recovery, it could be for a short, medium or long-term span of time. It really depends on that individual's needs, and the good thing about the service is it's very flexible.
When we first start working with a person, it's really important to prioritise their needs. So we really need to have a stable home environment or a stable living accommodation environment, and then also that their mental health's becoming more stable, so with their medication with their psychiatrist or their GP, really to get the basic needs met, and then we can work on their life goals and some other things that they may need to support their care.
I think clients find it tough to constantly be repeating their story to doctors, clinicians, outreach workers. The advantage of having people come to around the table at Partners in Recovery is that we can all reach a shared understanding of that client's journey and where they're at in their life without making the client constantly repeat things or justify where they're at.
So an action plan is developed in Partners in Recovery for the client, but it's done by discussing with that client what their needs and what their desires are, and also talking with the key people that are involved with their life, whether it be a family member or services. What we do is we document that, we're clear about who's doing what in that plan, and that we're achieving those goals. And the role of the support facilitator is really to check in and make sure that those things are happening.
Spiritual and cultural wellness is essential for the recovery of an Indigenous person. As an Aboriginal and Torres Strait Islander support facilitator, we may often go out to other organisations who have Indigenous clients in the Partners in Recovery program and provide advice or just consult with the client to see where those needs are, which are quite unique to Indigenous people, where those needs aren't being met.
The good thing about Partners in Recovery is we have access to brokerage funding, which means that we can really access resources that may not be available in the community.
I think definitely the Partners in Recovery can help to work with GPs. Sometimes we can meet with the GP in their office and the consumer, and also just to let the GP know what other supports they're currently receiving. So sometimes it might be updates, not necessarily always one-on-one contact, but just communicating between the GP and the consumer and their other support needs.
Partners in Recovery is very flexible, so it can be easily used with Aboriginal people. It's also very holistic, which I think fits in well. Often Indigenous people, once again, will have many services involved in their care, and Partners in Recovery can just provide a way of those services communicating. Sometimes Indigenous people, they might access a lot of Indigenous specific services, but then there's also services that are more mainstream, and there's not a lot of communication between those two.
We've got a number of referrals that are people from non-English speaking backgrounds, and there's a real challenge in that because there might need to be an interpreter involved. But the good thing about Partners in Recovery is that we can source that resource and use that in our dealings with family members and the client themselves.
I'm looking forward to the most with support facilitation is actually, at the end of the day, providing a better standard of care for clients with persistent and severe mental illness, people who need it the most.
I think it can really support family members and carers that the load's been taken off them a little bit, so that we're coordinating their care and looking out for things that person may need that they don't currently have. So it can take a lot of the worry away for the carers.
If someone wants information about Partners in Recovery, then you can ring the central intake number and somebody will talk to you about the information you have and see if the service is suitable for you or not.